The Department of Public Health's Tuberculosis Control Program is working with the Department of Education on a reported active case of TB at John F. Kennedy High School. TB Control Program Manager Cecilia Arciaga doesn't say if a student or staff was diagnosed. She does say the individual was diagnosed on April 26th, and she met with school officials the following day. She says right now her team is narrowing down the list of contacts exposed.
So basically, the contacts that were exposed were, of course, the classrooms and the bus riders, and of course we're ready to do the screening on the 16th of May, and with assistance from the Department of Education, school counselors, and of course public health nurses. We will be providing the skin testing for free on site at the school.
The May 16th screening will be from 8 a.m. to 12 noon at the JFK campus. Meanwhile, we also asked Arciaga if this case is linked to other strains found at different schools or the Guam Memorial Hospital. So far, she says, they aren't linked.
To date, we have not seen any epidemiological linkage with the other cases that we have. But of course, that takes a while. Although we do genotyping on all the cases, it's going to take a while to get these results back from our laboratory.
Last year, Arciaga says 101 active cases were reported in 2010. Since January of this year, over 35 cases have been reported. She notes Guam's rates are high, 15 times more than the U.S. and 8 times more than Hawaii. With TB symptoms such as longer than a 2-week cough, chills, fever, night sweats, or fatigue not usually evident until 2 to 12 weeks after exposure, Arciaga says it's important for people to practice preventative measures.
People have to take care of their health. And number one, I think, issue is that if you're a diabetic, you need to screen for TB at least every year. Or every time you go to a physician, go through a symptom questionnaire to make sure you're okay. Because we're seeing more and more of our cases with the diabetes as a comorbidity.